Hello and welcome to Wonder Hub. Today we're going to talk about the digital healthcare workplace. Now, a digital healthcare workplace is similar to other digital workplaces, intranet, where it's a hub for collaboration, communication, content management, but definitely with a focus for healthcare. Healthcare has a number of unique challenges, such as regulatory, governance, and security. And so definitely the digital healthcare workplace is focused on some of the unique challenges that healthcare faces. But from WonderHub's perspective, as we've been designing our digital healthcare solutions for our clients, we've really been taking an eye towards how do we take some of these functionality applications that we're leveraging for the workplace and leverage those to solve other really challenging scenarios that healthcare systems are facing because of COVID-19. We have really been out there talking to a lot of folks trying to figure out how we can help with this situation. And, there have been a lot of feedback about a number of challenges. And so we've designed a prototype solution that we're going to demo for you today. And we're looking forward to sharing it with you. My name is Perry, and I'm the founder of WonderHub. And WonderHub really focuses on working with companies in different verticals, manufacturing, financial services, trucking, you name it. And we work a lot in terms of understanding what the core problems are and what the challenges are, and then leveraging either existing applications or cost-effective applications like Microsoft 365, like Valo, like Orchestry, and to come up with solutions to help resolve really large problems that companies are facing. And we thought we could take that experience and perhaps help the healthcare system during this really challenging time. As we spoke to a couple hundred different individuals in different job positions, administrators, providers, nurses, of course, we love nurses because, I think every person, like half my family is nurses, so I have to say that. But we heard a lot of the same information. And to paraphrase a quote, unlike many industries in healthcare, access to the right information at the right time can mean the difference between life and death. Well, that's a heavy statement, and it's one that we really took very seriously when looking at how we might be able to support healthcare systems during this really challenging time. So, one of the core problems is EMRs, and EMRs are not designed to rapidly respond to anything. They're designed to be stable, they're designed to run healthcare systems, they are very secure, they're very powerful. They are taking care of things like lab results and billing and expenses and updates and charting, but they're not really the system that you can go in and rapidly design a brand new workflow and business process within a matter of a day or two to solve an immediate problem. They are rigid by nature, and I mean that not as a pejorative, but just as a fact based on what their core priorities are. Again, healthcare systems being under so much scrutiny, they've got to have rigid systems in place to ensure that their exposure and risk is minimalized and that they're able to provide the highest quality of care without any unforeseen, outages or problems. Well, again, that is exactly what EMR should be doing, but that doesn't necessarily solve the problem when you find yourself in the midst of a pandemic trying to rapidly respond to a number of different problems and challenges. So in looking at those type of scenarios, perhaps a platform like Microsoft 365 with some other third-party tools such as Valo is a good way to go. So that's really our expertise is Microsoft 365. And so we went out and during our conversations with all the different healthcare professionals, we identified 7 things that we feel that Microsoft 365 would be a great fit to help resolve. And they are the e-visit scenario. How do you manage that whole process? It's just not about, giving someone Zoom and, pinging grandma. You have to really track everything, schedule resources. You've got to be able to give folks the opportunity to schedule easily from outside of the healthcare system. So there are a lot of challenges within the e-visit. However, Microsoft 365 with tools like Bookings and SharePoint and Teams really help solve the problem actually really quickly. Forms, process, and workflows. If you got to come up with a new set of workflows based on different processes that changed because of the pandemic, that's not something you can do really quickly in an EMR. You need other alternatives that you can do that securely. Employee communications, of course, and we're not just talking email here. We're talking how do I get the right information about updated treatments, procedures, best practices in the right hands, and also make that content searchable and easy to find. Telehealth, really excited about telehealth. We're not looking to replace existing telehealth organizations, only provide some overflow capabilities. So now when healthcare providers find themselves with a panel that's 5 or 6 times larger than normal, they can look to readily out-of-the-box tools like Microsoft Teams, like Bookings, like SharePoint, to easily collaborate and communicate with their patients, no matter where they're located, from consumer internet devices. Scheduling and screening, I heard stories about putting tents in parking lots. How do you schedule that? How do you take resources that you have to put into a sporting arena because you're treating so many people and schedule those and track them and make sure they're readily available? Your EMR is probably going to not make that happen for you right off the bat. So how do you use other tools to be able to support those needs? Temporary healthcare workers. This is a big challenge. All of a sudden you have tons of folks showing up into healthcare systems they've never worked with before, and it can be frustrating. You don't even know where the bathroom or the cafeteria is, and you don't want to bother people because everyone's really busy. How do you get that information in the hands of your healthcare workers? And you do that by creating their own digital workplace, by having a portal that's just for your temporary workers, that's secure and locked down, and gives them access to all the content they need really quickly from their mobile devices. And speaking of mobile, all of this should be available via mobile. Currently, healthcare, not all content is available during mobile devices, and that's for good reason. Some content, definitely anything with PII, should not be available mobily, but there's a lot of content that can help healthcare workers do their jobs more effectively that you could share on mobile devices, and you should share on mobile devices. And we're going to talk about that as well. Now, all of these different items, we're going to have an individual video for each one of these topics and use cases. And one of our core focus points is really going to be that of security. We are not just talking about throwing up something willy-nilly. We understand that, all the same rules and regulations apply, and you've got to be able to, be audited and have reporting and be secure and not be hacked from the outside. We get all that. So all the stuff that we'll be proposing within these next videos, all these solutions, is really going to be focused with a heavy security bent as well, just to make that clear early on. So stay with us. Before we go on, though, we just want to give a big thanks and shout out to all our healthcare professionals who are in the trenches right now. We know how hard things, we hear it all the time, and we just want you to know that you are appreciated. And if there's anything we can ever do to support you, please don't hesitate to give us a call here at Wonder Hub, and we'll do whatever we can. All right, stay with us. Next video, we're going to talk about